and we only expose that part of the breast that we're checking. If she doesn't have a bra on, she needs to put one on for support and wear it 24/7. If she has a bra on, just expose the one breast and bring the bra strap down where you can get to it, okay? And then you're gonna use the pads of your fingers and go around the whole breast. You're checking for warmth and you're looking for redness. This means that the milk has come in that area and she's engorged. The milk ducts are clogged. You don't want that. So if you feel an area of hardness, let's say here, then we would chart that we feel hardness in the upper outer quadrant of the right breast. Does everybody see why I call that upper outer quadrant right breast? Okay, good deal. And then I'm gonna cover this breast up and then come over here and do the same thing with the other breast, palpating and going around it and then looking at the nipples for cracks or fissures, okay? Everybody good with that? Montana, are you good with this? You're so far back? Okay. All right, I want you to be able to see. All right, then we're gonna come down, okay? And we don't have to, let's take this off because she's postpartum. She's had the baby, okay? Let's make this go away. All right. All right, so she doesn't have that on. We've had the baby, all right? Now, we're gonna learn that right after delivery, the fundus, what's the fundus?
Top of the uterus.
Top of the uterus rises right above the umbilicus, and then about 12 hours later, it begins its downward descent back into the pelvis at the rate of a finger breath a day. Now, that's a new OB term that you gotta learn how to spell, finger breath. Finger breath is the width of your finger. And we chart the fundal height according to finger breaths above or below the umbilicus. Okay, you gotta know how to spell umbilicus, I guess, too. We can't say belly button, all right? So you put your hand right above the symphysis pubis, always, to support the lower uterine segment, and let's say she's 2 days postpartum. Good enough? So I'm gonna palpate in the middle, and I don't need to be just poking. That means you don't know beans about what you're doing. If you know what you're doing, you're gonna know to palpate, find her umbilicus, and palpate 2 finger breaths below it, okay? Now, if it's not there, maybe she's not descending at a rate that she should, and I need to go higher. And there it is right there. And you may have to stick your fingers in that far into her belly. And if she's post C-section, it may hurt, all right? And when you are at the fundal height, the height of the fundus is gonna feel like let's say a softball, and you're going right over the top. You can feel your hand going over the top of that ball. It is as cool as it can be. All right, so I feel it. I can feel my hand sliding over the top. It is firm. Everybody touch the end of your nose. Touch the end of your nose. Push on your nose. You see how firm that is? If your uterus is firm, it feels like that. Now, push on your belly. See how that goes in? That's boggy. That means the uterus is soft, it's not contracted like it should be, and a boggy, B-O-G-G-Y, uterus contributes to postpartum hemorrhage. So you want to keep it tight. You want to keep it firm. So let's say, now, that it's firm, it's 2 finger breaths below the umbilicus, and it's at the midline. That means it's in the center. That's exactly where it should be. If it is not in the center, but it is displaced to the side, everybody listening to this? The mama has a full bladder, and the full bladder has displaced the uterus. You've got to have her get up and go empty her bladder and come back and see if it returns to the midline. Now, so what do we want to have mama do before we start all this? Oh, make sure she's gone to the bathroom. But that is a standard NCLEX question on palpation. The fundal height is displaced to one side. What would the nurse do first? Have the mama empty her bladder. Okay? And see if it returns. All right, everybody with me on that? Everybody understand? All right, so fundal height. Now we're gonna come down here and we're gonna put her in lithotomy position Okay, she would have these little elastic panties on that hold a Kotex pad. I actually have them back there. I wish I had put them on her, and I didn't think to, guys, but we'll look at those, okay? And the panties are one size fits all. They don't come in small, medium, large, extra large. They're just little net panties. And so you ask her to take them down, okay? And you pull them down just a little bit. And you are actually, this is what the panties look like, and the pad just goes inside. The Kotex pad is called a K-pad, N-O-B. All right, and do you see these don't really look like panties, but that's what they are, and we keep a ton of them in the bathroom, so if they get soiled, you just change them and throw them away. Everybody see what they look like? They're not real becoming, they're not real sexy, but they are what they are. So you just lower the pad, and you look at the blood. And there's 4 ways to chart it, and we're gonna look at it with the lecture. But you chart, is it scant, small, moderate, or large amount on the pad? You wanna chart if there's any clots. You wanna chart if there's any foul odor. Foul odor can indicate infection of the uterine lining postpartally, all right? The discharge is called lochia, L-O-C-H-I-A. We'll get to it in lecture, but you want to note the color of the lochia. It changes color. The first 3 days it's red, and it's called lochia rubra, or red. So you're going to note lochia rubra, small amount, no foul odor, no clots. Then on day 4 to day 10, it changes to like a yellowish brown color. It's called lochia serosa, S-E-R-O-S-A. They're usually home by then. And then after day 10, it changes to lochia alba, A-L-B-A. Anybody know what alba means? White. And that discharge can persist until about week 6. So you're going to teach mom at this time the stages of lochia, and you tell her, if you've progressed to lochia serosa while you're at home and it returns to alba, you need to notify the doctor something's not right. All right? So she has lochia rubra, moderate amount, no clots, no foul odor. All right? She can put her legs back down. Should she have an episiotomy, and you know what that is now from your chapter where they cut her for delivery, or have hemorrhoids, you have her turn on her side, Sims, and you get your pen light out and you look at the rectum, okay, and note the hemorrhoids, because special Anusol cream can be ordered by the nurse if she has hemorrhoids. It's on the standard order, but the pharmacy doesn't send it up unless you have hemorrhoids. And if she has an episiotomy, that's a surgical incision. Now guys, you're not gonna see it. You can't get down into her business close enough to see it. But if it had popped open, or if it was having foul discharge, wouldn't you be able to see that? Yeah. Mm-hmm. So you're just shining your light in that area, and you would note, no episiotomy intact, no foul drainage from the episiotomy site, no hemorrhoids noticed. Okay. Then you're going to ask her if she's having any pain with voiding, because you can get a bladder infection postpartally. And has she had her first bowel movement yet? Because women, when they've had an episiotomy, or if they've tore when they delivered, they don't want to have bowel movement. Hurts too bad. So, and in the routine postpartum orders, there's an order for Dulcolax on the 2nd postpartum day if no bowel movement. So they're sent home on the 2nd day, right? So before you send them home, you want to make sure they have a Dulcolax. Some doctors order suppository, some order pill. But that's real important, okay? So they don't struggle at home to have that bowel movement. Then we're going to do Homan sign. Can you draw your feet back to your head? And she'll do it. And we're asking her we don't touch. We're asking her if she has any pain in her calves. If she says, I have pain in my left calf when I do that, then you're going to feel the calf for warmness, do not massage, and you're going to look at it for redness. And if you suspect something, you're going to measure your calf circumferences, and if there's a DVT, this leg will be larger. Now and then you're going to note, last parameter, how mama is bonding with baby. Okay, is mama holding the baby, talking to the baby? Because some mamas have problems after they have their baby. They have psychological problems, okay, and they can develop postpartum depression, and they won't have a thing to do with that baby. Grandmama's having to do everything in the room with the baby. That needs to be told to the physician. That's abnormal. So that home health nurses can follow up with that mom at home, because postpartum depression can progress to postpartum psychosis, where they're having hallucinations and they hear people telling them to kill that baby. Okay, do you remember several years ago when that mama killed all 4 of her children, and it was later attributed to postpartum depression that went into postpartum psychosis? Y'all may be too young, but it wasn't that long ago. All right, so that's real important to know. Now, that's postpartum assessment, okay? And it's not that hard. Do you see that it's not that hard? And then on that handout is your charting of it. And just remember how you did it and charted head to toe. Look over your charting before SimLab, okay? Because we will chart for a SimLab grade. These are things we would have done in clinical had we been there, all right? Now, let me tell you one thing also. At the beginning of the shift, on each shift change in OB, you still have to listen to hearts and lungs and stuff. So you're gonna do the head to toe assessment as we learned it, with heart and lungs, and you can do that one and then come back and do your 8 OB parameters, or you can work in your 8 OB parameters as you work down the body for the first time. And then this postpartum assessment has to be done every 12 hours. So at noon when you come back to do it, you're just gonna do the 8 OB parameters. You only do the full head to toe at the beginning of the shift. So I would listen to heart and lungs, and then what would I do? Breast. I'd listen to the abdomen for bowel sounds, and then what would I do? I'd find the fundal height, make all the charting about it. Then I'm still gonna ask about voiding, right? And so you're gonna work your OB parameters into your regular head to toe. You can chart it all together if you're doing your beginning of the shift head to toe. One other thing I wanna mention, if the mom is C-section, doing the deep palpation of the fundal height can be very painful. You don't have to do that on a C-section mom if she's not having a lot of lochial discharge, okay? But if she's a C-section mom, she still wears a pad because she'll have some lochial discharge. And if it's a large amount, then you just tell her, I'm sorry, but I gotta find your fundal height and make sure that it's firm because you're bleeding too much. Everybody understand that when that is indicated? The last thing I wanna say is, for any patient, when you are finding the fundal height and noting finger breaths below the umbilicus, if it is boggy, it feels like your belly, then you're gonna hold your hand here to support the lower uterine segment, because they say it could flip it out. I've never, inversion of the uterus, but that's what you're trying to prevent. So you're gonna do circular massage of the fundal height. You're gonna just keep your fingers in one place and massage in a circle. And you will literally feel the uterus tighten up and get firm under your fingers. It's the biggest miracle I've ever seen. I mean, it just does it. And then now they're not gonna bleed. And that's why we check it every 4 hours. The 8 OB parameters are done every 4 hours.
Did you teach mom to do that to herself?
Yes, you do. And you teach, that's a good point, Jeremy. You teach mom how to do that and she can check it at home, okay? By about day 12, I believe it is, the fundal height is not palpable anymore, okay? So we teach mom to do that. All right, so those are the issues with head to toe postpartum assessment. You can practice it on mom if you want to. She's up here, that's why she's here. One thing you can do, mom's fundus can be changed. You can let the air out and make it boggy. And then you can pump it up and feel the difference in boggy and firm. It'll change. I love this mannequin, okay? So then you just pump it up and tighten it to hold the air, okay? All right, so you can play with that. And I've got her uterus secured to her abdominal wall with some tape. All right, that ends 8-point postpartum assessment. Okay?